Topical medicines are applied to the skin. They are commonly used and are especially useful when the medicine is intended for a particular part of the body. Just like any other form of medicine, topical medicines have the same potential to cause harm and side effects, and therefore must be given safely and appropriately. Unfortunately, topical medicines are often prescribed without any specific instructions. All too frequently, the instruction "as directed" or "apply to affected area" is given, which is inadequate advice for you to follow. For any topical preparation, it is important to know the following. Where should the medicine be applied on the body? How frequently should it be applied? What is the length of treatment? An ideal instruction would say, apply twice daily to rash on left leg for 7 days only. If you have any doubts about how the product should be used, you should contact the healthcare professional who prescribed the treatment, or the pharmacist. Follow these instructions when applying topical products. Explain to the person what you need to do and obtain their consent. Wash your hands and wear disposable gloves. Ensure you are familiar with the product and any necessary precautions for its use. If applying a treatment from a tub, it is preferable to remove it with a scoop device rather than your hand. Apply an appropriate quantity to the area of skin to be treated. Gently smooth the product into the skin in the direction of hair growth. Pain relief products containing anti-inflammatories, such as ibuprofen or diclofenac, can be rubbed gently into the skin. If you notice any signs of irritation or soreness, report this to your manager or the GP. Wash your hands when you have finished. Finally, remember to sign the medication administration record. By doing this, you are stating that you have applied the product as prescribed and instructed. Unlike other forms of medicines which are prescribed as specific doses, it can be difficult to know exactly how much of a topical medicine to give. Emollients such as dermal or cetraben should be applied liberally to ensure maximum hydration of the skin. The best time to apply emollients is after washing, bathing or showering, as they are more effective than bath or shower products to maintain skin hydration. In contrast, steroid creams should generally be applied as thinly as possible to reduce the risk of side effects. For steroid products, a standard amount known as a fingertip unit is used. A fingertip unit, or FTU, is the amount squeezed out from a standard tube along an adult's fingertip. A fingertip is from the very end of the finger to the first crease in the finger. The prescriber should advise how many FTUs to give. Creams and ointments are packaged in tubs, pump dispensers or tubes and can be assumed to last and be effective if unopened up to the manufacturer's expiry date if stored under the appropriate conditions. Unless labelled otherwise, you can follow the manufacturer's expiry dates for opened tubs, pump dispensers or tubes as well. If you have any questions about giving topical medicines, please speak to your manager, the pharmacist or the GP.